welcome to Community Connection, your window to the world around you. My name is Siham Awada Jaafar. There are many questions about chiropractic care, and today we're going to be answering them with my guest, Dr. Sheila Makool. Sheila has been practicing chiropractic for over 20 years, so help me welcome Sheila Makool. Welcome, doctor. How are you?
I'm good. How are you?
Good. Thank you for being on Community Connection.
Thank you for having me.
Chiropractic care has always been at the forefront of many wonderful things as well as controversy. What was your inspiration? Why did you want to become a chiropractor?
Oh, well, there's actually two parts to that answer. I started out as an art major and was in a fine arts class, and we had many models that we had to draw, and I was actually trying to draw the human body and just struggling. And I found myself just opening anatomy books and trying to learn the structure of the muscles and how they ran, and so that I could better draw them. And I just developed this this liking to what I was reading and what I was finding. And I found myself actually memorizing all the muscles and all the bones of the human body. Just in one night, I memorized everything. And it was just this fascination that I developed with it. And then around the same time, my uncle, who is a chiropractor, and my father, who was working with him, they came to me and my siblings and said, you know, your uncle's practice is thriving, and we want one of you guys to kind of help him carry on the practice. And so I knew that was me. My hand went up immediately, and the next thing I knew, I was off to chiropractic school.
That's amazing. So you started off in art history,
in art,
actually
right.
wanting to draw things.
I was an art
be an
major.
Artist. Well, that's wonderful. And then you became interested in the human body. So I know that your uncle is a very famous chiropractor.
Yes, he is.
He used to do a lot of commercials too. I remember growing up, I used to watch these commercials. Feel Better with Dr. Makool. Naturally with Dr. Makool. So we have another generation of Dr. Makools coming up.
Yes.
I know that there's a lot of controversy in terms of the medical industry versus the chiropractic industry.
That's correct.
How do you envision that controversy in terms of what you see and what you do?
Well, chiropractic has long since developed. Chiropractic was actually discovered back in 1895, and it's been around for over 100 years. And it's taken its time in developing, and over the years it has just developed to a point where it's becoming even more accepted now and more desired because of its ability to help people without the use of surgery and medication, which is something that people are more and more wanting to get into. Nobody wants to take medication for long term. Nobody wants to go, into surgery if it's unnecessary. So they're looking for other ways, and chiropractic is the way. And actually, when going to college, chiropractic versus medical, the two are very, very neck and neck. The first 2 years of college. Chiropractic school and medical school are basically the same thing. In fact, chiropractors actually have more hours in anatomy, physiology, chemistry, biology. They have more hours in those classes, in those subjects, than medical doctors actually do. And then the last couple of years where medical doctors are more apt to studying pharmacology and immunology and things like that, chiropractors are learning the art and science of adjusting the spine and learning our natural way of healing.
I was really shocked that, not shocked, but pleasantly surprised that a lot of the insurances do cover chiropractic services. I mean, Medicare, Medicaid even covers it. Armed forces insurances cover it. A lot of the workers' compensation cover it. So obviously there's, a direct line to its wonderful way of healing versus the medical industry. Take us through a visit. If somebody were to come into your office saying they have lower back pain, which is what, 40% of people actually experience lower back pain, if
yeah.
not more.
Yeah, it's probably even more.
And that's really one of the major causes of not being able to work, not being able to function.
That's right.
So what is your treatment to that? Somebody comes in and says, "Oh, my back is killing me. I have lower back pain, and I haven't been able to fix it with medications." Right. Motrin 800 is usually medication of choice.
Well, let me just say that, in taking medication, all you're doing is really masking your symptoms. You're not doing anything to solve the problem. So
Absolutely.
that's first and foremost. And I think more and more people are recognizing that. But, taking a pill is so much easier than, taking the time to go and schedule a doctor's visit. The first visit into my office is very, very intense because we don't just throw people on the table and just start racking and cracking and moving their bones around.
Well, there's x-rays involved.
Yeah, it's very, very intense. We do a complete chiropractic, orthopedic, and neurological examination, very, very similar to what orthopedic doctors do. So it's a very intense examination that tests their muscles, tests their nerves, tests their bones, and it's a very intense testing procedure that we do. Evaluation. So it's a very thorough examination. The second thing that we do before I touch anyone, I have to visually see what their spine looks like. I will not go in there and just start, manipulating the spine without knowing what's going on. Most people don't know the condition of their own spine. Most people will have a problem with their spine and not even know about it. Pain is a signal that lets you know that there's a problem. Sometimes there's not pain. That's why what we deal with, it's actually called the silent killer. It's the term that we use to find misalignments in the spine is termed a subluxation. And a subluxation is known as a silent killer because you can have bones out of alignment in the spine that are pinching on a nerve, not necessarily causing pain, but could be causing dysfunction of the body somewhere else. Because if you don't understand the anatomy of the spine and its relationship to the nervous system, then you won't understand how that is in complete control of every function of your body. Complete control.
That is fascinating. That is really fascinating.
It really is. I've really seen miracles happen with this type of work.
So after you've done the complete evaluation and you find the issue, I mean, somebody could come in with back pain,
right.
And then through your evaluation, you may find some issues through the spine that may be causing arm pain or leg pain or some kind of underlying disease that they're being treated for. So how do you go forward with that?
As a doctor of chiropractic, my job is to look at the whole spine as a whole, because it's really considered one bone, interconnected. Sure. And the spine consists of, as you can see there, from the very tip, if you want to hand me that, I can just kind of show you, walk you through that. It really consists of the occiput, which is considered the skull bone. It's the bone in the back of the skull, where it attaches onto the first vertebrae in the spine.
Okay.
And then from there, it goes all the way down to the tailbone, and then the hips, of course, are part of it. So this is considered the spine, this whole structure right here. These are all the parts that the components of which I manipulate. So if I'm taking an x-ray of someone, what we normally want to see is when we look at these bones from behind, we are looking for the alignment of these bones so that it's straight all the way down. Any deviation in that spine can cause nerve impingement, and that either causes pain or dysfunction. So we're looking for...
And every single movement or every single spine connects or affects different parts of your body.
That's correct. So if a patient is coming in with lower back pain, 9 times out of 10, I will take a full spine x-ray. Because what happens is that patient may be coming in with lower back pain, but they could have problems with the upper part of their spine that could be torquing it and affecting the lower part of their back. And unless I look at the whole thing as a whole, and put all the pieces of the puzzle together, I'm only getting one piece of the puzzle. And so therefore, I'm not very thorough in my diagnosis. Insurance companies, unfortunately, want us to only target the area of pain. But what they don't understand is that the spine is considered one bone, and one area could be affecting another area. And so I will 9 times out of 10 take an x-ray of the full spine, and a lot of the times, I hate to say, I do find problems in these other areas. But as a thorough doctor, I will target each and every area, and in doing that, I'm getting my patients better faster because I am taking care of each component as opposed to just narrowing in on that one area of pain.
What kind of underlying conditions do you see that you have been treated with adjustments?
It's amazing.
Maybe treatments that usually medically you have to go and get, medicine and surgery.
It's truly amazing. First, I have to explain briefly the philosophy and the anatomy and the science behind all of this. When you are dealing with the spine, you are dealing with, first of all, the protective covering of the spinal cord itself, which is part of the nervous system. The nervous system consists of the brain, which sits up here and is protected by the skull. The second component of that is the spinal cord, which is the tail of the brain, and it extends the full length of the spinal column. These bones are here to protect the spinal cord. The brain and the spinal cord make up the central nervous system, which controls and regulates every function in your body.
Absolutely.
Every function. From the spinal cord are these little spinal nerves that exit, and these are the nerves that go to all the different parts of our body and tell our body what to do. So it tells your lungs to breathe, it tells your heart to beat, it tells your stomach to digest. These nerves
tells your legs to function.
Tells every single cell of your body what to do. So whenever there's any kind of interference with the signal that is
if you move it just a little bit that
this
way.
Yeah. Okay. So here's the brain. So it's sending a message down through the spinal cord and out through these nerves. So if we're referencing, let's say, this part of the spine and these nerves, these are the nerves that go to the heart and the lungs. If there's any type of misalignment here, impinging that nerve, what it's actually doing is it's cutting off the communication. It's blocking the communication between what the brain is trying to tell the body what to do. So that communication is cut off, sometimes just by a few millimeters, a little bit of pressure. So a good analogy that I use in my office is that when you're watering the grass with a water hose and someone comes along and steps on the hose, what happens to the water flow?
It stops.
It stops or it slows down depending on how much pressure is on it, right? So if you can't water the grass, what eventually happens to it?
It dies.
It dies. So if we're having a message from the brain, an important message that's coming down through here and trying to get out through these nerves, and that message is blocked and it's telling the heart to beat, all of a sudden what may happen is you may develop a slower heartbeat, or maybe a rapid heartbeat, or some other type of dysfunction with the heart. So it really depends on where these nerves are going. So my job is to take those x-rays, find every single area that might be affected, go directly to that area, gently try to realign those structures, and that will take the pressure off of the nerve. It'll restore normal mobility into the joints, and sometimes patients get off the table absolutely pain-free from their first adjustment. Sometimes it's not always that easy. It really depends on the condition of the spine and the person and the age and other circumstances. There have been really unique situations where I've actually helped women get pregnant because of the blockages in their lower back and those nerves going to those reproductive organs, and women not being able to get pregnant. And then after a few adjustments, we're firing up those nerves again, and all of a sudden they're able to.
The communication is there between
the communication is there between the nerve and the body. And just really amazing things, a lot of different conditions can be helped.
So you're talking almost every organ in the body is affected by
Not
the
almost.
communication.
Absolutely every organ
in the
every
body.
cell, every part of the body is able to function or dysfunction from the nerves.
So when they say, so somebody comes in and you do the entire evaluation, and now you want to do the manipulation in terms of making them better. A lot of people say once you start going to a chiropractor, you have to go all the time. Is there a time frame? Is there certain manipulations that are time sensitive, or is this something that once you start, you have to continue going all the time?
That's
for
a really good
maintenance?
question. Let me ask you this: when you go to the dentist, do you only go one time?
No, absolutely not.
Absolutely not.
I'm
when you go to the
dental-phobic,
doctors
so.
for your checkups and things like that, no. But there is
I think
a
the
point.
vision of chiropractic is you go in, you get an adjustment, and you
Right.
come back out. So maintenance is really important.
Okay, there's actually 3 different phases to chiropractic care. There is the acute phase, where somebody's coming in, they're in acute pain, and we're trying to get them out of that initial pain. When we take our x-rays, we know the correction that needs to be made, which takes us to our second phase, which is the corrective phase of chiropractic care. Once we can get them to a point where we feel we've stabilized their spine, in other words, they've come in for enough visits to where their pain levels are starting to go down, we're feeling like they're getting more stable, they're not in any pain anymore, that takes us into our third phase of maintenance. There's things that we do on a daily basis, our activities of daily living, that will constantly take these bones back out of alignment. There's poor posture, bad sleeping habits, bad sitting habits, we've got the computers now where everybody's at the computer screen.
Absolutely.
And you notice your head going more and more forward like this, creating strain in the spine. So there's things that we do on a daily basis that constantly take our bones out of alignment, or our muscles, pull our muscles. All your bones are wrapped in 4 layers of muscle. So stress alone, stress is a huge factor. Stress alone contracts the muscles attach to the bones. When the muscles contract, they pull the bones out of alignment as well. So there's too many things to name that can pull these bones back out of alignment. So of course we get our patients feeling better. They go out into the world, they start doing their activities, their mechanics, they're at the computer all day long, they're lifting, there's too many things to name. So of course they're going to throw their spines back out of alignment. They come in for maintenance at that point, and it's much more easier to correct rather than just letting it go, and then bringing them back to the acute phase where we have to kind of start all over again. So the acute, the corrective, and then the maintenance is the way to go.
And I think that makes a lot of sense. Do you find that you're seeing a lot more patients because of our computer phase, and I heard something on the news the other day where a lot of people are getting a lot of neck aches because of the iPhones, and because looking down to check their their information, and
all
so
the video geeks and the gamers, and
I have to say I feel the same way. I mean, my neck has just been terrible, and I sit on the computer all the time. That's usually all my work is sitting on the computer, and it really takes a toll on your body. So if you really don't have a specific ailment, if somebody comes in and says, I'm just in pain because I'm sitting all day and I'm looking at the computer, I mean, does that make sense to go in and get an adjustment?
Absolutely. There really isn't anything that walks through my door that I feel that I can't help. We don't claim to cure anything. We claim to help the body to function as optimally as it can, because we're removing any kind of interference in that nervous system that could be causing discomfort, disease, dysfunction.
What about with the medical industry? I mean, how does the chiropractic industry and the medical industry work together? Say if someone does have a chronic disease, a terminal disease, medication, of course. We can't rule that out. That's something very necessary. So how do you work together to create a comfort level for that patient?
I would really, really love more medical influence on what we do. There's a lot of skepticism about chiropractic, though. I believe it just stems from non-education. There's many people, even medical
Lack of
doctors,
knowledge.
who really, so a lack of knowledge, that's a better term. There's a lot of lack of knowledge of what we do. Really, all we're doing is treating the musculoskeletal system, which involves bone, nerve, and muscle. In my office, what we do is we deal with every one of these components. I don't just adjust the spine and then let my patients go. We have physical therapy in my office, which is a part of what we do in dealing with inflamed nerves and muscles. We have massage therapy, which is another part of what I do. So, for example, if I find structural problems, or even if I don't, many times if it's a muscular problem, chiropractic still helps because we involve different types of treatment to any particular condition. So that could involve the massage therapy, that could involve components of physical therapy involving either ultrasound, maybe muscle stim, heat and cold packs that help either decrease muscle spasms or decrease inflammation in the nerves. There's so many ways that we treat our patients in involving every one of the different structures that could be involved. We really leave no stone unturned. We really focus in on all the different components that could be causing that pain, not just the bones or just the nerves or just the muscle. And if patients are coming in and they're under a doctor's prescription, we don't take them off their medication. We never tell them, oh, don't take that. No, there is a time and a place for everything. If we are able to help that patient and maybe possibly wean them off of that medication, that's our goal. And we love to work with medical doctors in helping us to do that. Because ultimately, long-term use of medications hurt people.
Absolutely.
They don't help people.
What kind of conditions have you come across where you were able to wean them off of actual medications and drugs?
I've actually helped people with high blood pressure in lowering their blood pressure. Cholesterol is another thing.
Cholesterol with
absolutely.
spinal adjustments.
Yes.
Interesting.
There is really, I have to be honest when I say this, there is no condition that can't be helped with chiropractic because we're dealing with the nervous system, which again controls every function of the body. When your immune system is down and you get sick, and you go to the doctors, and what do? They put you either on antibiotics or something to help you, become better. What we do is we remove the interference on the nervous system, which in turn boosts the immune system and allows the body to fight things off naturally on its own. So in boosting the immune system, we've given the body the capability of completely taking care of itself. You see, the body has an innate intelligence. It has its own ability to heal itself. All we're helping it do is remove the interference to allow it to do it the way that it's supposed to, the way that God made it to do it. And that's all we're doing is just removing that interference and allowing the body to just take care of itself naturally.
I think with so many drugs on the market, and I read I listen to some of these commercials, and when they say their disclaimers, it's like
those are scary.
Oh my God, that's more scary
Yes.
than the actual ailment
Yeah,
itself.
they're really.
So sometimes when you look at alternatives, and I think that may be the route people are taking, especially in in this day and age.
Well, people want a
is for
quick fix,
Yeah, but alternative medicine as well. Something where they can heal naturally.
Right, they're turning to that.
Absolutely.
Right.
And also herbal. Medications and natural, treatments are very much on the rise. So how do you incorporate that kind of, medical industry with this? I had a friend of mine, real quick, that was a medical doctor, and she totally left her practice, and she went into herbal medicine and prescribing those natural things. So how do you deal with that with your practice as well?
Well, there's different types of chiropractors. There's two kinds actually. There's straight chiropractors and then there's mixers. I actually started out as a straight chiropractor, meaning all I did was adjust the spine, and that was about it. Now I'm at the point where, I've realized through my practice, through trial and error, through different things, that incorporating other things into the practice just brings more of faster healing and a more overall, what's the word I'm looking for? Recovery, thank you. Using, in my office, we do use supplements and herbs, because I believe in healing from the inside out. I am taking care of the spine from the outside. I'm making my manipulations, and I'm finding the misalignments, and I'm trying to relieve the nerve pressure. But a lot of times people have deficiencies in their bodies too. For example, in Michigan, there's a lot of vitamin D deficiency because of our lack of sunlight exposure.
Sunshine. What was that? Sun?
That's right.
I'm almost forgetting what that's about.
Exactly. And so that's very detrimental
People get
to your
depressed
body
as well.
It's very depressing, and with that lack of vitamin D causes a lot of dysfunction in your body too. It leads to a lot of chronic conditions and a lot of
emotional conditions.
Absolutely.
Too.
So in dealing with supplements and making sure that you are supplementing along with this, it helps the body heal, it helps the body recover, it helps the body function even better than without incorporating those.
Many patients too with cancer go through the chemo and the radiation, and it's always been a mystery of mine why part of their treatment is not supplementing the nutrients that they are losing within those treatments as well. So that is very, very, very important.
Nutrition is one of the most important parts of good health.
Absolutely.
If you're not getting your nutrition in, and your water, proper sleep, and you have to have a positive attitude too, because negativity really manifests into the body too. And people who come in who are depressed, who have negative attitudes, that also shows up in their body, and their muscles become tight, and their body's affected from that. So there's so many different components to good health. But they're very, very small changes that you can make, but they make huge changes in your body.
Right.
Huge changes.
And I think the holistic approach in terms, and I love what you said, inside out.
Because from the inside out.
When you're feeling good inside, you look good outside.
That's right.
So that is so important.
That's right.
Dr. Sheila Makool, I know that you had mentioned your uncle earlier,
yes.
And he really was a visionary and someone that really brought chiropractic to the forefront. And Dr. Siham Makool was really a legend
yes,
in our
he
area
is.
here. He's really done a lot, and just so glad that through your artistic abilities, found chiropractic, and you just I do believe that you're very passionate about what you do, and
Extremely.
Very knowledgeable.
Thank you.
And I want to thank you so much for joining us on Community
Thank you
Connection
so
and
much
sharing
for
your
having
knowledge
me.
with us about chiropractic. And I know there's a lot of misconceptions, and I think we cleared them today. And I'm going to come see you because I have this really bad kink in my neck.
I would love to have you.
So I'm coming over.
I would love to have you. And let me just say too that chiropractic care is extremely safe. And one of the things that we also do in my office is we do a lot of traction, which is just general stretching of the spine, because there's so many things that we do that compress the spine, and that causes a lot of disc problems too. And I'm sure that you know that chiropractic is extremely helpful for disc conditions and things of that nature. Because of the compression, we do a lot of the decompression, and that helps to alleviate a lot of pain and chronic problems.
Does it make you taller?
Yes.
It does?
Yes, it does.
All right.
I always ask my patients before I
really
start traction, how much taller would you like to be?
Your practice is in Dearborn, right?
It is in Dearborn.
All righty. Wonderful. I will be there. Thank you so much for joining us and sharing your knowledge and your expertise
Thank you
on
so
chiropractic.
much.
And thank you very much for joining us on Community Connection. We will see you next time.